KwaZulu-Natal is in the midst of an oncology crisis.
So the third week, they called him again for treatment because they had given him dates to come. So when he went there, machines are broken again.
I just felt like I was robbed of a sister. And the kids were robbed of their mother because the kids loved their mother unconditionally.
It's reported that in just 1 year, more than 300 cancer patients died in one hospital as a result of being unable to access life-saving cancer treatment in time.
I put to the public in South Africa that this case and the number of people that are dying currently is far greater than those that died in the Life Epidemic matter. Yet there is no justice for them.
Almost a year after the Human Rights Commission found the Provincial Health Department and MEC Dr. Sibongiseni Dlomo of having violated the rights of cancer patients, we visit the province to find out just how oncology services ground to a halt. This is Lawrence Naidu, a pastor and father of 3 from Phoenix, south of Durban. 4 years ago, he started getting sick, complained of bleeding.
He started going to a number of hospitals in the area. And then from there, they started doing tests and what, but they didn't pick up the cancer at that time. They diagnosed him with piles. So he was under the impression, okay, it's piles, he's getting treated for it, but it wasn't coming right still, it wasn't getting better.
For more than a year, his family says he was referred to different state hospitals without a proper diagnosis. In September 2015, he was finally diagnosed with stage 2 rectal cancer.
Our whole world came crashing down because we knew cancer was something, very intense. And we didn't expect my father to go through this because he was such a good person.
The family says at Nkosi Albert's Luthuli Hospital, he underwent tests, was scheduled to start chemotherapy and radiation, but week after week he was told the machines were broken.
In that space of time, this cancer has been spreading so fast and vastly that there was no control of it because there was no treatment. So my father suggested, okay, so why can't I just go to Johannesburg and get my treatment there? Because that's how much he wanted to live. He knew he had a family to take care of. And so they had to beg this oncologist to give them a referral letter. He got the referral letter, and then they gave him a CD, and they said to him, on the CD, your whole history is on the CD, all your x-rays, what is there.
At Charlotte Maxeke Academic Hospital in Johannesburg, he received 20 sessions of chemo and radiation, but by then the family was told he had reached stage 4.
When the time was up for the chemo and the radiation, and the oncologist said, you know what, you can have a break. If you want to go back to Durban, you can go back to Durban. If you want to stay, you stay. So my dad took it upon himself, and he says, you know what, I'm fit enough. He felt he's self-healthy enough to go back to Durban, and he missed his family. He missed my mom, he missed my brothers, he missed his grandchildren, and he missed his house. I mean, no matter where you stay, but your home is your home.
He died weeks later at King Edward Hospital, but his family blames the delays.
If there was treatment on time, he would have survived.
Cancer is a collection of diseases. It occurs when an abnormal growth of cells multiply in an uncontrolled way, and in some cases spread. There are 4 stages. Cancer that's diagnosed at an early stage is more likely to be treated successfully. If the cancer has spread, treatment becomes more difficult, and generally a person's chances of surviving are much lower. In Empangeni, north of Durban, is Ngwelezana Hospital. 66-year-old cancer patient Ubabu Mzawulungi Mkhize says he was sent home by the hospital with pain medication to wait for his death because his cancer was at an advanced stage. The family found out in January this year that he had stage 4 lung cancer, but the hospital scanner, a machine which detects how far the cancer has spread, was not working, and as a result he was given a date in August this year to come back for a checkup. The day before our visit, however, he had gone for a scan because the machine had been fixed after waiting 4 months.
Njengomndeni kwasiphatha kahlungu kakhulu ngoba ngalelo langa mhla sizwa lokho sakhala singazi ukuthi manje kufanele simshonisephi kwakuthi ngisha izingane zakhe azangazi ukuthi sifanele senze njani njoba saze sathola lo dokotela nokho ukuba usekhona ukuthi kube ngconywana kumphethe khona kodwa nje kwathi ukuthibeka ngabuza ngamakhimo kwathiwa no ichemo ngeke sakwazi ukuya kwichemo, he's too weak for ichemo and all that, and then i-radiography leyo ke waze washo nayo ukuthi abayiphathi ngisho ukuyiphatha ke i-radiography ukuthi yeah. Since then siphila nje nge-stress, yabo ulala ucabanga ukuthi okay namhlanje ngizoza ukuthini, namhlanje namhlanje sizomsusa mhlambe simyise kuphi, yonke leyo nto leyo. It's really hard. Ngiyabona bonke abantu but for umanje kunzima kakhulu ngoba naye umdala ngokwakhe ukulokhe ba up and down and all that. Yeah.
Let's cross over live to Griselda Lewis, who is standing by at the arbitration hearings.
But I didn't think about it at the time that people could be dying.
Let's update your sports news.
Get all the dominating stories locally and globally on Newsroom every Monday to Friday from 9 a.m. SABCnews.com is your one-stop digital portal to all the news you need. With a website that is easy to use on mobile, SABC News prides itself in being the primary source of public service content across multiple platforms. Watch live streams of all the big news events on the SABC News YouTube channel, which is one of the most viewed South African YouTube channels globally. And catch up on the best of SABC television and radio news. Follow breaking news on all of the SABC News social media platforms, interact with SABC News on Facebook, and stay connected on Twitter for the latest headlines and real-time updates by our reporters. SABC News, everywhere.
The families of many deceased cancer patients in KwaZulu-Natal blame the Department of Health in the province for delays in getting treatment for their loved ones.
I've seen the treatment here in Johannesburg and I've seen the treatment in Durban. There was no treatment in Durban. Also in November when they gave my dad a referral to Johannesburg, they gave him a date for May the next year for treatment, to start his treatment. So imagine from November, December, January, February, March, April, May, 6-7 months you had to wait to get treated. My dad didn't survive so long. My dad couldn't make it to survive because he passed away in February. and he had gotten a date for May. So they failed us in a lot of ways.
In South Africa, there are over 100,000 new cases of cancer diagnosed every year. Globally, the figure sits at about 14 million cases per year, and that number is projected to rise to about 22 million by the year 2030.
Genetic predisposition actually makes up a small number of cancers. The majority of cancers are contributed to by environmental factors. Unfortunately, in our province again, we are seeing increases in cancers across the spectrum because on the one hand we have an aging population, and with age the incidence of cancer increases. There are environmental factors that contribute there in terms of lifestyle, diet, processed meats, lack of exercise, obesity. These contribute to those cancers that are associated with Western countries.
Dr. Seedit is an oncologist at the Hopelands Cancer Center in Hillcrest, Durban. He says the most common form of cancer found in men is prostate cancer, and in women, breast cancer. However, in KwaZulu-Natal, the deadliest cancer is cervical cancer. It's sexually transmitted and is preventable.
Cancer is an epidemic as well. It's often not recognized as such. If we look at the cancer incidence since 1994 in our country, there has been a 75% increase, and that is projected to double again in the next 10 to 15 years. So it certainly is an epidemic that is affecting our population. It certainly doesn't get the attention and awareness that it should.
KwaZulu-Natal is divided into two parts. The northern part, which consists of Pietermaritzburg, where Grace Hospital is the only state hospital treating cancer patients. In the southern part, there are only two state oncology facilities, Nkosi Albert Luthuli Hospital and Addington Hospital. Cancer patients require a referral to get into these hospitals and often travel long distances to get much-needed treatment, putting a strain on the already limited resources. Treatment options vary.
In terms of some of the available options, obviously we have surgery in terms of removing a lump. We now have a treatment called radiosurgery, where certain lumps that are not accessible surgically can be treated with radiosurgery. The chemotherapy is mainly aimed at stopping a cancer from spreading or treating cancer that has spread through the body. And then we have radiotherapy treatment, which is a non-invasive type of treatment, doesn't involve any cutting at all, and they were able to treat areas and eradicate cancer in those areas. There have been advances in terms of treatment, so a lot of the stage 4 cancers are becoming more like chronic diseases in that we're able to control them for longer and longer periods, but the majority of stage 4 cancers are unfortunately not curable.
As the family of 41-year-old Annie Mazra from Stanger in northern KZN found out, after a year of not getting the proper diagnosis, Annie was diagnosed with stage 3 cervical cancer in August 2016.
They scheduled her for treatment, I think, at Addington Hospital. And when she gets there, then the machines were broken. They sent her back. And then she had to wait again, I think, another 3 months for her next appointment. So, all in all, throughout her cancer, she has never received no treatment, nothing at all. And the only thing that she used to come home with every time was Tramadol, a pain medication, and there was another liquid, I think it's Laxon. I think that's for constipation, Those were like the 3 medications she used to come home with every time. I think if she was given that treatment, we could have had a little bit longer with us. And watching her in that hospital and the care from the health workers was also not good at all. But, there were times I could only see her in the evenings. I couldn't make it during the day to visit her. And I'll see her lying in her urine. The diaper used to be wet. Her bed used to be wet. Her clothes used to be wet. And she says she's been calling them, but they just ignored her.
The heartbroken family has been grappling for answers as to why the health system stripped their loved one of another chance at life and her dignity.
For me, I just felt like I was robbed of a sister. And the kids were robbed of their mother, because the kids loved their mother unconditionally. They loved her. And she was like their only hope. So, and now it's like kind of hard because I now have to replace my sister, you know, with her kids, and it's difficult. It's really, you know, like, I can't even find that words to tell you how upset and hurt, you know, I feel.
I feel it's a real person.
And it's nutritious and delicious.
It's good. I really like it.
This celebrates being South African. We love our beer, we love our food, we love our music.
For knowing who you are going, you must know where you come from.
I'm excited to be part of this year.
For all your travel trends, catch us every Sunday, 12 midday on Channel 404.
The Western Cape needs national government to fulfill its mandate on ensuring the bulk water supply.
We must ensure that the city of Cape Town never confronts this particular situation again.
The ESCOM is serious about stamping out corruption, which is why the market is now beginning to accommodate us.
Looking at neighboring countries, expecting Botswana just to see partly cloudy skies with a half 34 in Gaborone.
News today at 3 p.m. from Monday to Friday on SABC News.
National Cancer Registry data shows that in South Africa, about 1 in 8 people will suffer from some form of cancer during their lifetime. In KwaZulu-Natal, that translates to about 1.3 million people. But just how did cancer services in this province grind to a halt? The problems date as far back as 2008. At the center of the controversy are questions over the purchase of the oncology machines at Addington Hospital and the rewarding of a repair and maintenance contract for a further 5.4 million rand. The machines were bought during the tenure of former provincial health head Peggy Nkonyeni. But the contract for their maintenance was given to a company under Health MEC Dlomo's watch. The company, KZN Oncology, was reportedly not an approved supplier to government at the time it received the contract and did not have a written contract or order to undertake the work. The company was also not an authorized agent to carry out work on the machines. Chris Ndaliso is a senior journalist who's been covering the stories surrounding the crisis in the province. He says a task team visited the affected hospitals and interviewed the then head of department, Dr. Sfiso Mtshali, as well as CEOs and managers.
In the report, Dr. Mtshali says it himself that he finds it difficult to make changes in this crisis in the province because of political interference. It's in the report, it's contained in the report, that the MEC, it's difficult to differentiate between a political role and an administrative role. He actually pokes his nose where he doesn't belong. So a few weeks later, Dr. Mtshali was actually called to a disciplinary hearing. Dr. Mtshali was suspended and Dr. Mtshali decided to resign.
By 2012, the second state oncologist left, and years later there's been an exodus of more oncologists in the public sector. The department has now partnered with private sector doctors to assist.
I've interviewed at least a couple, and they have, made it clear that it's a mission to work in the public sector in this province. It's draining, on you as a person. And this one chap even said, I had to make this tough decision, not for myself, but for my family, for the sake of my family. And he left the department, So if you have these people leaving and you keep on saying you are recruiting, who are you recruiting? Let's see the results.
The provincial department's failure to provide oncology patients with adequate health care prompted the Democratic Alliance's Dr. Imran Kika to write to the South African Human Rights Commission.
The people that are responsible for all of this are, as they were suggested in the South African Human Rights Commission report, that the MEC and his department must take responsibility for whatever has happened. The number of people that have died, the number of people that are waiting, the number of people whose disease has progressed, all lie at the door of the MEC, who sat on his hands since the cracks started showing in 2012 and 2013. And he sat on his hands, allowed for the problem to deteriorate, to the extent that he responded in a parliamentary question to me that in the year 2015 and 2016, 349 patients died at Nkosi Albert Luthuli Hospital alone as a result of cancer. We suggest, or I put to the public in South Africa, that this case and the number of people that are dying currently is far greater than those that died in the Life Esidimeni matter. Yet there is no justice for them.
In a report in June last year, the South African Human Rights Commission found that the Provincial Health Department and MEC Dr. Sibongiseni Dlomo had violated the rights of cancer patients to have access to healthcare services.
We expect that there must be justice for everybody that died. We expect that there must be justice for all those that are suffering. We expect the Premier to do what he was expected to do in the first place. We expect that the MEC should have done what the MEC of Gauteng did, the honorable thing, and resigned. We expect that he must make himself available for accountability after resignation. And we expect that all the recommendations of the South African Human Rights Commission are adhered to the letter. We also expect that the National Health Ombudsman should do what the South African Human Rights Commission has recommended, that he investigate the technical aspects that will allow for closure for the many families that have lost their loved ones. And we expect that to bring this matter to an end, that the department, the MEC, his department, and the Premier must continue to act in the best interest of the people of KwaZulu-Natal, rather than put their party and their party politics first.
The Provincial Health Department is yet to respond to Special Assignment's request for an interview, but MEC Dlomo has since been summoned to appear before the Human Rights Commission this month over the lack of meaningful progress in dealing with the crisis. In the meantime, the crisis has increased the demand for palliative care in the province. Hospices such as the Highway Hospice in Durban have had to shoulder the burden as a result of the lack of oncology services in the province.
We've got over 600 patients, so a nurse can only cope with about 40 patients because it's quite high intensity and it's a very, very stressful job for the nurse. So the more patients that aren't being able to go into the hospitals are coming to us now, so it's increasing our load. And we aren't financially in the position where we can increase our costs.
Another experience we're having is a primary function of hospice care is control of the patient's symptoms, and the major one being pain control. Nobody wants to be in pain. So one of the treatments required is medication, and the one that works effectively once the initial pain medications are being used up and not being effective, found effective, is morphine. And morphine It's a drug, scheduled drug, it's an analgesic drug, and it's used for cancer pains mainly. But the need, getting it is difficult. I have a patient in the area that I'm working in, was just given a small bottle. The patient is, his mum is diagnosed as stage 4, which is towards the end of the disease process. And the level of pain that this patient is going to have is going to be in the region of 8 to 10. And they definitely need morphine to curb that pain. And because you're having weight, you're given a 100 ml bottle, you're asked to take 100 ml. I mean, you're asked to take 4 ml every 6 hours. If you do the maths, it's not even going to last you for a month.
Many terminally ill patients in the province have succumbed to cancer without assistance in making the pain bearable.
My father was just that type of person who you could sit and be comfortable with, and who you could pour your heart out to. That's the type of person he was. And yeah, so I don't know, I haven't seen another person like my dad. In my eyes, he was everything. He'll always be my hero, he'll always be my best friend, and it's really hard for us.
If there's anything in the MEC's power that he could probably divulge to his other people to please give cancer patients priority. You know, they should be given, you know, the utmost care and help first.